Welcome back to Talking Environment. I'm your host, Gevorg Ghazaryan, and today we are diving into a conversation at the intersection of climate, health, and justice. And we are going to explore how the places we live and the air we breathe shape our well being in profound and often unequal ways. And to help us explore and break down these topics, I'm joined by Dr. Maryia Bakhtsiyarava, who is an assistant research professor at the Urban Health Collaborative and the Department of Environment and Occupational Health at Drexel University. So, welcome to our podcast. Thank you for so much for joining.
Hi, Georg. Thanks for organizing this and for inviting me.
Thank you. Could you just give us a little bit of breakdown of your research focus? What do you work on?
Sure. I'm an assistant research professor at the School of Public Health at Drexel. But originally, my background, so when I started doing my undergrad, my academic background started in geography and GIS. So when I was an undergrad, that was my major, and that really taught me like the skills of working with spatial data, wrangling large data sets, and just thinking critically about the data that we receive. And then I pursued my PhD, and during my PhD, I actually started working on projects related to climate and migration. So I started, I was a PhD student at the University of Minnesota, and I worked at this Minnesota Population Center, the Institute for Social Research and Data Innovation, and they house one of the world's largest projects that integrate data from international censuses, from like the U.S. domestic census, as well as data on the environment. And so that's where I really got exposed to this question of climate and how it may affect human well-being. And actually, at first I started working on climate and migration studies, and it was very interesting. Maybe the things that I still remember from the days that for the most part, it's really hard for people to migrate. It's very disruptive. It's really expensive, and even when it comes to environmental migrants and things and people who get displaced because of different disasters or because there's a drought in their region and their crop fails, it's still a lot of people want to stay.
Yeah.
And so it maybe runs against this popular notion that people just want to leave and like go elsewhere, and there's going to be this huge crisis of all these people coming from these climate affected areas. So people usually they want to stay put, and it's very difficult and hard to migrate. And so then when I was this is some of the work that I did when I was doctoral student. That was not really my dissertation. But then when I started working on my dissertation, it was about climate change and food security in Ethiopia. And that's when I started really looking at things like crop yields, sort of on the agricultural sector side, and how temperature and excessive precipitation, or the opposite, insufficient precipitation, can actually disrupt livelihoods and cause food insecurity. And then another way it can manifest is also in the birth outcomes. So when women are pregnant and they are not able to either have a good diet during pregnancy, they don't have enough to eat, that can really have a negative impact on the baby, and that baby may be born low birth weight, which can have a whole host of problems for that baby later on. Or sometimes the opposite. Sometimes there are these conflicting sort of incentives, if you will, where if the rainfall, say in an agricultural region, a lot of the work that I've done is in Ethiopia. So we actually did this one study, and we saw that sometimes when the rainfall is actually really is good and the conditions for growing crops are great, women actually tend to breastfeed less because they need to go and work. They don't really have time. And so that can also have an impact on the development of the baby and like their weight. And so sometimes, it's hard to, it's very difficult to to manage all these climate hazards in these agricultural regions. Yeah.
That's interesting. So you had an experience working in different continents, and have kind of insight into all these places.
Yeah.
Concerning the climate. Why did you decide to kind of get into this field? What was like a decisive factor for you?
So I think when it started, when I started working on climate and migration, it was just because there was an opportunity available. There was a postdoc who was working on some of the climate and migration papers, and he just offered for me to work with him, and I really enjoyed it. And then my doctoral advisor, when she joined my department at the University of Minnesota, and I read a few of her papers that looked at different vegetation indices and birth outcomes and food security. I was actually really fascinated with how I guess it got me really interested, and I was really fascinated as well by the fact that I can use some of my GIS skills to help me do that work. Yeah. But I also have to say that that work that I was doing, a lot of the studies were from sub-Saharan Africa, and the data landscape there is very different compared to what I work with now. So right now, I'm part of this big project called SOLARBAL, or Urban Health in Latin America, and it's this really big multi-university collaboration that is whose aim is to investigate climate and climate-related disparities in health outcomes. And in the U.S., some of the participating universities are Drexel at Berkeley. So I actually did my postdoc at Berkeley before. And we have a lot of partners in Latin America with whom we work. But that research is primarily in cities. And so just sometimes I compare, how much even data I have on health outcomes in the current work environment, right, where we are looking at cities and the country, and Latin American countries are generally richer than countries in sub-Saharan Africa. So a lot of the vital registration systems, like the systems that track live births, deaths, and other events like hospitalizations, they're better developed. And so it definitely empowers us to know more about how climate and climate-related exposures may affect health in those countries, but at the same time, it also exacerbates the fact that in some of those poorer countries, like the ones in sub-Saharan Africa, because of the lack of data sometimes, there are still gaps in our knowledge, and sometimes we don't know. And those are the people who suffer maybe the most from climate change, and so unfortunately, that fact also exacerbates the health disparities there.
It actually makes so much sense. And so, what would you say? I mean, you said now you're working mostly on urban health and more concentrated more on cities. How would you say some environmental exposures connected to climate change actually affect the health outcomes in those cities? Would you say there are already some evident changes that are evident on health, or is mostly projections that we project with the data that some health problems will arise from these issues in the future?
Yeah, no, we don't have to wait to the future to see the negative impacts. We're actually seeing them right now. In fact, a lot of the work that we are doing is, most of the work that we are doing is we are basically creating evidence about the burden of climate change related exposures on health. So some of the things that are working on are ambient temperature. So it's the outdoor temperature usually, although arguably indoor temperature is also very important for human health. But for example, in our work, we looked at the burden of mortality that is attributable to heat and cold, because it's not just heat. Cold temperatures are also important. And what we see from our work in Latin America is that, say, over the study period, which was from about 2002 through 2015, about 7 or 6% of all deaths that occurred in the region could be attributable to non-optimal temperatures. So and non-optimal is either heat or cold. but the vast majority of those deaths could be related to cold. So about 5%, I think, can be attributable to cold, and only about 1% is attributed to heat. But then when you look at the risk of mortality at really high temperatures, it is actually much higher at the like really extreme temperatures. Extreme when it comes to heat, not when it comes to cold. So, and as global warming progresses, we actually did a projection study. I think it's about to be published soon. We also see that even though because global warming precedes unusual, like on average, the temperatures are rising, which means that there are more days when it's hot and when it's warm, and because of that, the cold-related mortality goes down.
Yeah.
But that decrease in cold-related mortality is not going to be enough to offset the growth in heat-related deaths. And so that's what we see, that in these urban areas in Latin America, and in our work, we usually work with 326 to 370 large cities. That's the burden, and it's going to increase. I mean, so the heat is only really one aspect of this. There are also other exposures that happen. So another thing you can think about is not just these continuous events like temperature. Okay, so you've had days of relatively warm temperatures, and that can have an impact on human health. But there are also all these extreme events, such as cyclones, hurricanes, and they can also really exacerbate the health conditions that people already have. They can result in injuries. Things like floods, for example. There's thousands of deaths every year in the world that occur because of floods. And so there are all these exposures as well. Another thing that is worth mentioning when it comes to urban areas that is unique is the urban heat island effect. So it's this phenomenon where in the city centers, the ambient temperature or the land surface temperature is usually much higher than at the peripheries. And that is because, city centers are densely built. There's a lot of glass and concrete and asphalt, like all of these materials that absorb temperature, and then they emit it, at night. And so overall, it's usually a few degrees warmer in the city center than it is at the periphery, where it's, or in the rural areas, if you look at not just within the city, but also city versus rural areas. And so that also really makes people who live in cities more exposed. Another thing is air pollution. It's also in research, it's a little bit hard to really say whether air pollution, like how air pollution interacts with heat, because usually if you think about pollution like ozone, it's in cities it happens to be the worst on like hot sunny days when there's like little wind to blow that pollution sort of through. And also because of how it forms. So the ozone in the lower atmosphere, it occurs. So it happens when nitrous oxides and different volatile organic compounds react in direct sunlight. So sunlight is actually needed for that to react. And then when we already have, all the emissions from traffic, the dust, the industrial emissions, all of these things come together on those sunny days and create like the smog, for example. And that is a very, it's a very serious health threat, because in general, in the world, about 7 million people a year die from air pollution. And ozone, for example, it has a similar effect on lungs as the sunburn on the skin. So it kind of like burns the lungs. So it's, and then, besides ozone, there's also particulate matter and all the health problems that it causes.
Thank you so much for breaking down all these exposures and how they affect. So do you work mostly work with specific territories in Latin America, or it's generally all across the continent?
It's pretty much across the continent. So it's Central and Central and South America. We have we work with maybe 11 countries or so, and we have these partnerships with universities in those countries. And so we have this fabulous data and methods team who's based here at Drexel, and they are the ones who reach out to, say, countries' statistical offices to get, data on hospitalizations or data on live birth registrations or mortality records. And so I think it's been a great collaboration and a great resource. But it's also been extremely it's been amazing that we've been able to work with those countries.
Yeah, that's great. Having taking all the data from all of these places and working with all of them. So, you have worked with, you said, 11 countries and a lot of communities. Would you say there are specific communities that are more vulnerable to these changes, or is mostly kind of similar all across the places?
No, there's definitely a lot of variation in both the exposure to these climate risks, such as heat waves or just high ambient temperature, events like floods, right, within the region. So, and even when we're looking within the region, there's also a lot of variation within the city. Yeah, so even if we look at projections of ambient temperature increase, so by mid-century, by the end of the century, there are clear hotspots where the temperature may increase based on the different scenarios. Within the cities, what we see is that the pattern of variation in the burden and in the burden of heat-related mortality, for example, it can be a bit different from what we observe in the U.S., for example. So in the U.S., what we often know is that city centers tend to be, so the downtown areas tend to be hotter, and then usually it's a less desirable place to live compared to the suburbs, for example. So because there at the city periphery, there are all these nice leaf-lined neighborhoods, and things are not as densely built, and so on average the temperatures are a bit lower. There's more green space, but what we see is that a lot of the populations who may be vulnerable to heat, for example, in the U.S., they often resided in the city center. So it can be, racial or ethnic minorities or people like poor people, right, too. And then because these people happen to be more exposed because they live in these areas affected by the urban heat island effect, they are also the ones who do not necessarily have resources to or fewer resources to go and seek health care, or they may not afford to use AC as vigorously as you need in order to decrease your heat exposure at the home. But what we see in Latin America is a bit different. So when it comes to one thing that emerged from our work is that oftentimes in Latin American cities, the city centers are not necessarily all that devoid of vegetation, like what we see in the U.S., for example. And because of that, maybe partly because of that, we also don't really see this very evident or obvious effect of the improvements or increases in green space being associated with reduced heat-related mortality. Yeah, so it's definitely vulnerability to these heat-related and other climate-related outcome exists, and it exists across the sort of socioeconomic gradient.
Yeah.
It also exists because of where people live and because of the conditions of their built environment. Yeah, and so, and that unfortunately happens to be the same everywhere. That the individuals who are, strapped for resources or whose health is already affected by some, pre-existing conditions, for example, they're usually the ones at higher risk and at higher vulnerability and susceptibility to the detrimental effect of heat and other exposures on their health.
Yeah, and I'm sure that the human-made factors are also contributing to this, like more factories, more other places, especially near the cities. All this production going on is actually affecting more these exposures and helping them.
Oh yeah, for sure. Yeah, actually in the U.S., a lot of the environmental justice work began when people started noticing that a lot of the toxic dump sites and various polluting factories are located in areas where, for example, the Black population lives, and that was happening back in the 60s. So unfortunately, things have improved, but it's still very much a problem.
Would you say mostly these things are less regulated, let's say in Latin America, like concerning environmental justice, what they're being placed, how they're being located, how they're being regulated?
Yeah, I think so. And also, it's so interesting because Latin America is so urbanized. It's about 80% of the people in Latin America live in cities. And because this urbanization happened so fast and so many people moved into the cities, it was very hard for city governments to actually control it and keep all those environmental constraints on how humans organize its space in check. And so because of that, oftentimes green space was not really, so preserving green space was not really prioritized when people were moving in, because it was, let's just build more houses, for example.
There were more priorities at the moment.
Yes. Yeah. But I think now things are definitely improving, and there, a lot of officers who in city governments, even in Latin America, who are tasked with this objective of improving resilience of the populations against climate change.
That's good.
Yeah.
So you also mentioned the importance of data and statistics into trying to solve this problem, into tackling these problems. And you mentioned a couple of terms, GIS and spatial data science. Could you help us a little bit break down what that means, what kind of data it is, and how it actually helps your work?
Yeah, sure. So, because in the last few decades, there's been a lot of improvement and a lot of increases in the availability of say satellite or other data products that have been specifically created to monitor things like temperature increases or wildfires or air pollution. All this advancement in technology has really helped us be better informed and track the state of these things on the ground, as well as how it changes over time. And so a lot of the things that we work with places where we get our environmental data, to track air pollution or temperature or green space or wildfire locations, are satellites. And so it's satellites or other raster products, data products, and they usually look like a continuous surface. And it has values in every pixel. Also, the spatial resolution of these data have improved over time.
So it helps us visualize a lot more the data.
Yes, it helps us visualize, track progress, track how things change, and also it helps us construct better measures of exposure. So now, for example, we can have temperature data that can be like that that is quite precise, quite accurate in terms of how it presents conditions on the ground, but also kind of fine scale. Like we can have temperature data set where temperature is measured for every pixel, say for example 800 by 800 meters, and that can really allow us to investigate neighborhood level heat exposure and how variations in and look at the variations in heat exposure, across neighborhoods, and can help us elucidate some of those disparities in exposure that exist. Yeah, so that's what the data landscape usually looks like. We have some sort of a gridded data set or data from the satellite, and we use that to we usually process it, in some sort of a numerical format. For example, we extract temperature summaries for cities for a particular time period, or we create these measures of, say, heat waves. So, how many heat waves, did the city have over this time horizon and things like that. So, yeah, so I guess that's...
and what is GIS? How does it open?
Oh, yeah. Oh, GIS is the Geographic Information Systems, or Geographic Information Science.
Okay.
And that, for some people, it's an actual... it's the main subject of their research. So so they really study that. It's their work. But, say, for people like me, I mostly use it as a tool. As a tool that helps us, create and process some of those... some of those data.
Interesting. Yeah. So technological advancements is more data-based to collect data. Helps actually the process a lot in the research.
Yeah, that's true. And it's also not just spatial data. It's also improvements in just statistical modeling. So right now, a lot of the models that we use to look at the effect of temperature on, say, mortality, or the effect of temperature on hospitalizations, we do, say, in R, for example, the R environment for statistical computing. And there's been all these packages that have sprung up because of the work that a lot of the researchers have been doing. And these packages have been so helpful in picking the right statistical tools to look at the temperature mortality relationship. For example, we now know that relationship is not linear. So, for example, it can be the temperature mortality curve can look like a J shape or like a U shape, and there can also be different lags, and that relates to the notion that when we have a day with really high temperatures, we do not necessarily see an increase in mortality right on that day, but can happen a day after. Or when it comes to cold, that delayed effect can actually be much longer, up to 21 days. And so all that statistical modeling has helped us capture all these different intricacies in the temperature mortality relationship, and it also helps us evaluate and know the burden better.
Yeah. Interesting. Yeah, that's really interesting to know how these data collecting systems are also developing and helping the research more. And so one thing I wanted to go back to, you said, for example, the green spaces might not help as much because as it might seem. For example, what is something that during your work that you noticed that the cities, the government should work on more toward when trying to solve these problems? So what is one thing that you think that we should pay more attention to and work on it more from your perspective?
Oh, it's a great question, and it's also really hard because I can say a lot of things, but it takes a lot of agencies to work together to actually bring this into reality. But maybe one thing that would be great is if the climate and health is that health is better incorporated in the climate resilience agenda. So a lot of even if you look at the international meetings, the Conference of Parties, the United Nations Framework Convention of Climate Change, they have been featuring health not really as one of the main things that will be affected by climate change. They have all these goals that are great, that are aimed at reducing emissions and adapting to climate change. But it was only recent that they recognized that climate and health should feature more prominently as part of this climate resilience agenda. And so it shouldn't be, the inclusion of health in these climate programs should not be an afterthought. It should be one of the primary things to do, because sometimes when you talk to people, they don't immediately think of health as something being affected by climate change. And so because of that, I think the inclusion of climate front and center in that agenda can be great, because it will help people. I think it might just bolster the importance of supporting all these different climate actions, because people will understand better that it actually can affect health. It's not just somewhere far away people will have a drought and they'll have less crop yields. No, it can actually affect people right here and right now.
I believe. I also believe that because also it kind of creates an urgency for the people, as it might affect their personal health, and it might have a personal connection actually to them, and it's not being talked about enough. So people do not actually think that it might affect their personal health also. And to kind of start wrapping up, what is some message? What is something that you would want people to know about the intersection of climate and health? So we talked about the importance of talking about it and how important it is. What's something that would like to people remember and to always think about that?
So what would I want some people to retain from this? I mean, maybe the most important thing is that climate is affecting our lives. It is. I know that the start of this message is maybe a bit sad, but that unfortunately there are so many more deaths worldwide that are happening because of climate. So one number is, there was this recent study and it showed that overall every year there's about 5 million deaths that can be attributable to non-optimal temperatures, so both heat and cold. But even though all of these negative outcomes are happening, I think it's very important to focus on your mission, like for me, for example, as a researcher, and know that we have there is hope, and we have the tools to do the best that we can to help the climate systems, the health system, to adapt to the rising threat from climate, and to improve our resilience. And that can take on so many different forms. So we have the tools within our disposal to change our behaviors, right? So not only to reduce our environmental impact, but, choose less car trips, have more sustainable forms of transportation, eating less red meat and things like that. And so those are some of the individual steps, but there are also things that we can affect as an engaged community. There's a lot of cities, even Philly, for example, has this Office of Sustainability, and within it there are different programs aimed at the heat resilience plans and other health plans that have to do with bolstering our resilience against climate. And usually the city offices invite people to comment or join some of the meetings. And so I think getting engaged in the climate advocacy work is also is also great and is also important and can help us further down the road.
Yeah.
I know that sometimes when I talk about these sort of individual behavioral responses, people can get upset because, well, there are all these fossil fuel companies that are emitting all these pollutant gases that cause our atmosphere to warm up. But why do we have to shift the burden of that on us? Why do we have to change our behaviors? So I understand that sentiment, but I still think that there's so many co-benefits to walking more as opposed to taking a car ride or eating less red meat, for example, that are also beneficial to your own health. That I think it makes it inviting and beneficial to join in on those efforts to improve our climate resilience.
Great, thank you so much.
Yeah, thank you.
That's a great message to leave with.
Thanks.
So thank you so much for joining us today.
Thank you for inviting me.
It was great to have you, and for all these things that you have said, for all the important implications and all the experiences that you have shared with us. It was great to have you.
Thank you.
Yeah, thank you so much.
Thanks.
And thank you for joining to another episode of Talking Environment. Make sure to follow us on YouTube, Apple Podcasts, and Spotify. And make sure to not miss the next episode. So until next time. Thank you.
Bye.